Understanding the issue, bleeding after sexual intercourse, also known as postcoital bleeding, can be a concerning issue for many women. While it might seem alarming, it's important to understand that it's not always a serious problem. The causes can range from minor irritations to more serious underlying conditions. Common causes of bleeding after sex: infection, sexually transmitted infections. STIs like chlamydia or gonorrhea can cause inflammation and bleeding. Hormonal changes: women going through menopause or those using certain birth control methods might experience vaginal dryness, leading to small tears and bleeding. Cervical conditions such as polyps, erosion, or cancer of the cervix can cause bleeding. Vaginal tears, forceful intercourse, or the use of certain sex toys can cause small tears in the vaginal tissue. Endometriosis, a condition where uterine tissue grows outside the uterus, can cause bleeding, especially during or after sex. Signs and symptoms: spotting, small amounts of blood after sex. Bright red blood, heavier bleeding that may require a pad or tampon. Pain, discomfort during or after intercourse. Itching, an itchy sensation in the vaginal area. Abnormal discharge, a change in the color, odor, or amount of vaginal discharge when to seek medical attention. While minor bleeding after sex might not always require immediate medical attention, it's essential to consult a healthcare provider if the bleeding is severe or persistent. You experience pain, fever, or unusual discharge. You notice a change in your menstrual cycle. You have a history of pelvic inflammatory disease (PID). You're concerned about the possibility of an STI. Immediate treatment: rest. Allow your body to rest and heal. Hygiene: maintain good hygiene by washing the genital area with mild soap and water. Avoid intercourse. Refrain from sexual activity until the bleeding stops and any underlying condition is treated. Over-the-counter pain relievers. For discomfort, use over-the-counter pain relievers like ibuprofen or acetaminophen. Medical diagnosis and treatment. A healthcare provider will conduct a physical examination and may order additional tests such as Pap smear to screen for cervical cancer. Cultures to identify any infections, biopsy to examine a tissue sample for abnormalities. Treatment will depend on the underlying cause and may include antibiotics for bacterial infections. Hormonal therapy for hormonal imbalances. Surgery for more serious conditions like polyps or endometriosis. Prevention: safe sex. Use condoms to reduce the risk of STIs. Lubrication: use water-based lubricants to reduce friction during intercourse. Regular checkups: schedule regular gynecological exams. Conclusion: bleeding after sex can be a sign of various underlying conditions, ranging from minor irritations to more serious health issues. While it's often nothing to worry about, it's essential to pay attention to your body and seek medical advice if you experience persistent bleeding, pain, or other unusual symptoms. Early diagnosis and treatment can prevent complications and ensure optimal health. Thank you for staying with us until the end of this video. If you enjoy our videos, please give us a like, subscribe to the channel, and share your thoughts in the comments. Let us know what you'd like us to make videos about next.